So final topic are the porphyrias, and these are hereditary conditions arising from defects in heme synthesis. So these problems, you get defects in heme synthesis, you get buildup of the precursors. So we already saw this in sideroblastic anemia, we saw this with lead poisoning, but these are going to present a little bit differently. They're not going to present with anemias. There's two of them. There's acute intermittent porphyria and there's Porphyria cutanea tarda. Both of them have autosomal dominant inheritance. So acute intermittent porphyria we see here, the problem is defective porphobilinogen deaminase. So this doesn't work. You get buildup of the stuff before it. So you get buildup of porphobilinogen, you get buildup of ALA. And then for Porphyria cutanea tarda, it's a defect in this enzyme, the uroporphyrogen decarboxylase, and so that doesn't work. You get buildup of the stuff before it, so uroporphyrogen builds up. Sorry, just getting wrecked by these names and pronouncing them. So let's talk about them a little bit more. The first one is acute intermittent porphyria. I told you again, it's defect in porphobilinogen deaminase. This doesn't work. You get buildup of porphobilinogen, buildup of ALA. Buildup of that stuff causes symptoms, and the symptoms most commonly occur after the patient takes drugs that induce the CYP450 system. And the reason why this happens is these are the CYP enzymes, remember, and these enzymes, they stimulate heme synthesis. So you're stimulating this way, but you have a blockage here, so you're gonna get extra buildup of porphobilinogen, extra buildup of ALA. You get more symptoms. So the symptoms you get is they suffer acute attacks characterized by the 4 P's. So painful abdomen, polyneuropathy, purple urine, psychiatric abnormalities. So psychiatric, let me go through these quickly. Painful abdomen makes sense. Polyneuropathy, so just problems with the nervous system, so weakness, numbness, tingling in different parts of the body. Purple urine. Psychiatric abnormalities would be things like having hallucinations or even having anxiety. And the final thing to add is the skin is not involved in acute intermittent porphyria. I talk about that because the next one we're going to have it involved. So Porphyria cutanea tarda does have skin involvement. That's why the name cutanea. And this is the problem I told you on uroporphyrogen decarboxylase. Then you get buildup of uroporphyrogen. So at least the names make sense. So if the enzyme doesn't work, you get buildup of that uroporphyrogen builds up. And this stuff deposits in the skin, and that's how it causes problems. So you're going to get hyperpigmentation from deposition of the uroporphyrins. And you're going to get blistering of the skin when you're exposed to the sun. And it's because the uroporphyrins, I told you, it deposits in the skin, and then when it's exposed to the sun, it's going to release. Let me go back. You're going to get release of reactive oxygen species. That's going to damage the skin. You can get blistering. And finally, you can get tea-colored urine. Again, that's from the uroporphyrins being excreted out in the urine. So this is tea-colored urine. This is normal urine on the left, tea-colored urine on the right. So these are your two porphyrias. Again, both are autosomal dominant inheritance. They're defects in the enzymes that you need to make heme. Porphyria cutanea tarda is the defect in uroporphyrogen decarboxylase. You get skin symptoms. You get hyperpigmentation, so they're darker. You get blistering, and this is all from the uroporphyrin deposition in the skin. And then the other one was the acute, let's clear this, acute intermittent porphyria, which I told you about, porphobilinogen deaminase problem. You get buildup of those enzymes, and then you're going to get the 4 P's, painful abdomen, polyneuropathy, purple urine, psychiatric abnormalities, and acute intermittent porphyria. So that's it for our porphyrias.